The Rasmussen Center is a program aimed at not only providing prevention care, but early detection of cardiovascular disease. Our current program has 10 diagnostic tests and then blood tests to go along with that. Patients also get time to talk with a nurse practitioner about their prevention concerns, whether it's nutrition, exercise, weight management, supplements, anything that they have a concern about. Screening for early cardiovascular disease in patients with a strong family history is very important, particularly if heart disease issues happen in men 55 or younger or women 65 or younger. We consider that early cardiovascular disease. For people who are very healthy and their risk is very low, we usually screen every 5 years. For people where we identify more cardiovascular disease, then we would individualize that follow-up based on the level of disease identified. After you visit, you get your Rasmussen score. A score of 0 means that all the tests that we did on the heart and blood vessels were normal. A score of 20 means that they were all abnormal. And depending on that score, we would decide treatment and follow-up. A full report is written for the patient. Most medical reports are written for the doctor, and the patient gets a copy. Our reports are written for the patient, and the physician gets a copy. We feel that it's very vital for the patient to understand their prevention care, and they're really in the driver's seat when it comes to prevention. We want them to have all the information. Patients really enjoy the visit because we work really hard to make it something that's very informative to patients, that they feel comfortable talking and asking their questions, that when they leave the program they really feel like no matter what their results were, that they're in control and they know what they should be doing to stay healthy. For patients who come to the Rasmussen Center, they have a choice of getting follow-up care through their family physicians, which we encourage. But if they don't have a family physician, then we are able to help start prevention therapy and get them going and follow them if needed. And at some point in time, turn that care over to a family care provider. We do not require a referral, and I encourage people to check with their insurance company to make sure the cost would be covered depending on their medical background and history.